It's Dr. Lederman, and I'm here with
James Gallagher.
And James, I hear you're going to have a change in your plans now.
Yes.
And why are you having a change in your plans?
Because I was given approximately 6 months to 1 year to live, and it appears that I'm going to be living a lot longer.
Okay, so did we tell you that, or someone else told you that you had 6 months to live?
No, a local hospital where I went for another procedure.
And it's considered a pretty good hospital, right?
Yes.
And it wasn't the hospital that told you that, it was actually doctors there who told you that.
Right.
And they told you should get ready to live a few minutes ago you told me 6 months, but whatever, it was pretty bad prognosis.
Yes, they wanted to do, first they wanted to do surgery and then chemo. They decided to do the chemo first because the surgery might spread the cancerous cells.
Okay, so let's get back to the top actually. So the top is that you came here with pancreas cancer, right?
Yes.
So the diagnosis was pancreas cancer. And what were your symptoms when you went to that hospital?
I really didn't have that many symptoms.
Why'd you go to the doctor then?
I went because I was having ulcerative colitis problem. And that's when they discovered it.
Okay, so you had abdominal problems, right?
Right.
And they did testing on you and they found this pancreas cancer.
Yes.
And the doctors then sent you to chemo doctors and surgeons, right? And they told you you had this terrible prognosis, 6 months to live, something like that.
Right.
And did you have any treatment over there?
No, I decided not to.
Okay, so they were going to do surgery and chemo.
Chemo first, 6 months, and then surgery.
And why did you decline the chemo?
They only gave me, after the whole situation, if everything was successful, I would have only a 20% chance of living 3 years.
Okay, so they painted a pretty bleak picture.
Yes.
And have you ever had chemotherapy, or do you know people who've had chemotherapy?
I know people, yes.
And what's your impression of chemotherapy?
Most of the people I know that had it unfortunately died.
Okay, so chemotherapy doesn't work very well for pancreas cancer. And did the doctors tell you that it doesn't work very well?
No.
It doesn't cure pancreas cancer?
They did not.
So what did they tell you the expectation of the chemo would be?
Well, that it might decrease the cells so there wouldn't be as many cells, so when the surgeon operated, there'd be a better chance.
Okay, so what's your age now?
85.
85. Did the surgeon tell you what it's like to remove a pancreas in an 85-year-old?
He said it would be very difficult surgery, and I would have to be at least a week in the hospital and a week in a rehab facility. I would have drains, and I think he didn't want to really do it first, so he suggested chemo.
Okay, so he was kind of downplaying the benefits of surgery, and pushed you for chemo. And in my view, often people are pushed into chemo when there's no good option at that facility. That's my view. And I'm a chemo doctor. I'm board certified. I've given chemo to thousands of patients. So why did you give up on chemo and surgery over there? It's a well-known hospital, close to your home. Why did you give up on them? They were doing the best they could, theoretically.
I've been listening to your radio program about 6 or 7 years. And I decided that it sounded very logical, what you were saying, and I decided to try it.
Did you tell the doctors over there that you were going to come here?
No, I did not.
Okay, so then you came here, and what was your experience when you first came here?
I was very impressed with the facility, with the people here, and with Dr. Lederman.
Okay, well that's me, but how was your reception here different than with the chemo doctors or the surgeons over there?
It was just a more congenial situation.
So you felt more comfortable?
I felt very comfortable.
Okay, so, and then we talked about all the options before you chose anything.
Yes.
We did talk about surgery and chemo and radiation and radiosurgery and even no treatment, right? We spoke about all that. It's even on our booklet, all the options. Did the other doctors in that other hospital tell you about radiosurgery at all?
No, they said radiation, but not radiosurgery.
And what did they tell you about radiation?
That they would do it after I had the surgery, like first the chemo, then the surgery, then some follow-up radiation.
So they actually never told you the same options that we told you?
No.
Okay, so when you heard that you could have treatment in just as few as 10 treatments, What did you think?
I figured I should try it. I was very impressed with the facility.
So why did you trust us when you didn't exactly trust over there?
It made more sense, and I've been listening to your program and the questions people ask, and everything made way more sense.
Okay, so then you started out, we made a stereotactic frame, and we computerized your body,
Right.
and we sent thousands of beams in. So what did it feel like to receive treatment for pancreas cancer?
There was no real pain. I sometimes felt a little gnawing, but that was it.
Did you suffer in any way from the treatment?
No, I did not.
How long did the treatments last on average?
They were about a half hour, I think. They were 3 times a week for approximately 4 weeks.
Okay, and then you finished your treatment, right? And before you started, you actually had a PET scan to look at the extent of the cancer,
Yes.
right? So your PET scan showed a mass in the pancreas, and you also had cancer markers, which we like to get. Your CA19-9, which is a marker often for pancreas cancer, was very elevated, right? And your CEA, which is another cancer marker, was also elevated, right? And then you finished your treatment. And how did you feel when you were done with the treatment?
Felt quite good.
Okay, but how does it feel? At the other place, they told you had this 6 months to live, and you just told me a few minutes ago that interfered with your plans of life, right?
Yes, yes.
And that's pretty normal when they're telling you you have 6 months to live.
It was shocking.
It's shocking, right? So you were living kind of with this heavy burden of this prognosis on your head, and none of us really are God, believe it or not. We try not to act like God, or at least I don't. And we never really talked about living 6 months or whatever, but we did talk about the possibility of controlling the cancer where we attack it, and it's quite high in our experience. And your first PET scan, you went over close to home, you asked for a scanner close to home and went to a good facility, and you got a PET scan close to home, and then you actually downloaded the information yourself. And what was your report on your PET scan that you read yourself, even without talking to me?
Well, the first one was not too good, but the second one was cancer-free.
Well, the first one was before the treatment.
Right.
Okay, so I can't do anything about that.
Right.
But we did a little bit about the one afterwards. So we just went over that, and the one afterwards showed again. What did it show?
Cancer-free.
So the cancer went away.
Yes, which was very surprising to me.
Okay, surprising to you and happy to all of us.
Right.
And then we did other tests on you also. We did cancer markers like CEA, which also went down to normal range. And your CA19-9 went way down. So we actually have 3 separate tests all showing that you're in remission.
Right.
So how does it feel?
Feels absolutely wonderful.
And in your 85 years, how does this rank on the top 10 things that happened in your life?
I think it's number 1.
Number 1?
Right.
And you said a few minutes ago it's going to change your plans for the travel in the future,
Yes,
right?
I think I'm going to go on a vacation to Europe to see my relatives, and, just things I sort of had given up.
So it's given you literally a new lease on life.
New lease on life, new slant on life.
Okay, so now the treatment's long gone. Do you have any side effects now from the treatment?
No.
Do you have any ill effects from the treatment?
No.
Do you have any regrets about coming here?
Definitely not.
Was there anything that I told you at any time that was not true or honest?
No. You're very honest.
Were you ever misled at any time?
No.
How did the staff treat you here?
Wonderful. It was just wonderful.
How do you feel about all the people, tens of thousands of people have pancreas cancer every year? Do you wonder why so few end up in the hands of Dr. Lederman and radiosurgery?
Yeah, I guess there's all competing interests.
Okay, so do you think that everyone has the patient's best interest in hand, or do you think they're just doing what they've always done? Well, how do you think it works?
I think they're doing what they always did and hoping that things work out.
Mm-hmm. All right. Well, it's nice that new technology has changed your life, and actually it's changed many thousands. We've treated 40,000 patients, and we have many similar stories to yours, but none as beautiful as yours, really, at this moment. Maybe, later in the day we'll have another story, but our success rate's very high. So I'm very happy for you. I'm happy cancer is not in any evidence right now. You've got the best possible test, and you've got multiple. You have 3 separate tests all showing
Right.
remission. What's your advice for people with not only pancreas cancer, but any kind of cancer? Would you have any advice for others?
I would explore Dr. Lederman's treatment plans.
Would you ever think that the radio would give you this?
What do you mean?
That a doctor on the radio would end up giving a result?
Well, I'd be a little bit suspicious, but as I went along, I got totally non-suspicious. So,
okay. Well, I wish you well. Where are you traveling in Europe, by the way?
probably to Ireland, to my relatives.
When was the last time you were there?
About 6 years ago.
I hope you end up with a sunny, warm day.
Right, especially in the west of Ireland.
And I hope that you live to be 120.
Well, I hope so too.
All right, God bless you and thank you.